Good afternoon. I'd like to call this meeting to order. This is August 17th and a special meeting of the Board of Supervisors. Madam Clerk, could you do a roll call?
Supervisor Angus?
Here.
Supervisor Johnson?
Here.
Supervisor Gould?
Here.
And we have Supervisor Watson and Chairman Bishop here, so we are ready to go.
Okay. We'll begin this morning on our regular agenda. The first item will be discussion and possible action regarding an update from the County Public Health Director to the Board of Supervisors regarding recent issues, actions, events, and county responses regarding COVID-19, and taking any necessary actions based upon these updates. So Denise Burley is at the podium, and I'll turn the floor over to you. Thank you.
Madam Chair, members of the board, thank you for allowing me time today to share with you some information. We'll start off as I usually do with the numbers, that we have a total of 3,368 cases to date in our county. Of those, 2,157 have recovered, and we have 174 deaths. Our average age of cases is still 48.2. Our average age of deaths is still 76.8. So it's been slightly, very, very moderately changing in those numbers. We've experienced a 9% reduction in reported cases from previous weeks, the previous week. So the numbers last week, as you saw, went down. So we're seeing some positive trends, and having that occur 3 weeks in a row is a very good sign for us. So the mitigation strategies that people are practicing are really having an impact on those overall numbers. To build on that, the hospital report also reflects this. We're starting to see some of the strain removed from our hospitals, the number of people in ICU beds, the number of ICU beds in use overall has gone down statewide, and I think we've seen that decrease as well in our community. So some good signs there, and hopefully we'll look forward to more of those same signs. Any questions on the numbers in the hospital report?
Anyone have any questions? Okay, I don't see any.
Okay. As I mentioned previously, at a previous meeting, we were interested and expressed interest to ADHS in a contract to address the complaints that we receive for the executive order and businesses maybe not following the executive order, not to the degree that people felt was necessary. So our EH team from the get-go has been following up on those complaints, and we did actually receive the contract, and I've read through that contract to ensure that the focus for our department and environmental health staff will be on education, and it is. It's education and technical assistance are the two primary focuses of that particular contract. So we will be completing a board action form to put before you for approval to accept those funds. Any questions on that piece?
Hearing none?
Okay. We'll be putting together and we are in the process of putting together our new report and the format for this evening. That transition will occur this evening. We'll pull the extract at noon. So basically that information will be from noon today to noon the day before, so yesterday. So it's going to be pretty fresh off the press. We'll have that, we will have that available for you before 5 o'clock this afternoon, and we'll be working with Roger here on the press release and how to adapt his current press release to that particular format and make sure that he has all the information that he needs. Supervisor Angus made a few additional suggestions, which were more about labeling to ensure people understood the different tables that were in the fact sheet that we created. So we will be making those modifications. It's really just a label at the top to describe what it is. So, for example, in that bottom left-hand corner, you saw the list of communities. Those communities it would just be communities and cases by community. And then the additional would be the upper right-hand corner where we would put actual dates in, so you'd see the dates of those weeks, not just week 1, 2, 3, 4, 5, 6. So a little bit more specificity for everybody to be able to see what we're tracking. Any questions with that?
Madam Chair?
Supervisor Angus?
Yes, thank you. Thanks for making those small changes, Denise. I have one very, very small suggestion. It's, of course, up to your department. When you, in the middle where you have 4 different numbers, it starts with the average age of COVID case and percent of population. I think that the percent of population should either go on top or the bottom and have the average ages of the COVID cases and death and then the case fatality rate together. It's just moving that second one. I just think it flows better. It makes a little bit more sense to me. I don't know if it will to your department.
Okay.
And the numbers, again, these will be our numbers that don't necessarily line up with the state. Is that correct?
That is correct. Yes.
I'm not really, are we going to go back and ask more questions, or with this, Madam Chair, or is this the appropriate time to ask sort of just general testing questions and the like?
It's up to you, Supervisor Angus. You can ask questions now or when Denise is finished with her presentation.
Denise, which one do you rather prefer?
Well, if you're going to be asking questions about testing, it would be helpful towards the end because I do have some updates on testing that I'd like to share.
Then we'll wait till the end.
Okay, thank you. I appreciate that. We're also trying to work with schools and businesses. As you know, there are benchmarks set for both regarding reopening and what type of reopening setting, especially around education in schools, whether or not that's a traditional in-school setting, a hybrid, a combination of virtual and in-person, and then the virtual itself. What they've asked for is that we provide some more community-based information so that they can make community-based decisions for those particular schools. We do hope to have that available by the end of today, in which case we will make sure that we provide that to the board as well. But hopefully that will help school districts make those decisions and use that additional data in their school board meetings to make those best decisions for the kids, the safety of the kids, and the parents and the families and the teachers. So moving on to testing, just wanted you to be aware of a few testing events, or 2 testing events that will be going on in the coming weeks. The first will be in Lake Havasu City, and North Country Healthcare will be doing a testing event at the Aquatic Center this Saturday from 7 a.m. to 10 a.m. And then Bullhead City will be conducting another testing event at the police station parking lot on Friday, August 28th, and that will run from 6 a.m. to 9 a.m. I'm not sure of the process at this point in time as far as registration. I would recommend going to the North Country website and looking for information there, but I will also try to follow up and get more information that I can present to all of you so that the public can see that. Additionally, we were approached by Embry Women's Health. This was a small medical provider, OBGYN office in Mesa that saw an opportunity to expand testing throughout the state. So they started small, grew in the Maricopa area, started then working with community colleges. And so they are now expressing interest in moving out into the rural communities to increase testing in the rural communities. We spoke with them along with Mojave Community College Dean Carolyn Hamblin on Friday. And it looks like there is opportunity. It's free testing. There's no conditions. You don't have to be symptomatic. And I think it looks very promising. They'll be working very closely with Mojave Community College on that. They've asked if we would do some promotion of those particular testing activities once they start, but it does look promising to increase testing in our community. So that'll be a very positive sign for us. Additionally, sorry, Supervisor Johnson?
Yes, these people that are coming in, are they going to fill out their forms and get them to us any better than anybody else? Or I don't want to promote something if we're going to be getting limited information when it comes to us that we can't follow up on.
Great point, Supervisor Johnson. We will make sure that as we work with this particular group that we emphasize the need for that to occur. Additionally, we did receive a notice from Health and Human Services that they do have some resources available for testing events throughout our county. We'll be following up with that. At this point, I don't have any additional information, but do believe that we can look at some possibilities there. They're currently providing testing in Maricopa, Pima, and Coconino counties, but again, have some additional resources that they can bring out to the more rural counties if there's interest in them.
Madam Chair?
Supervisor Angus, go ahead.
Do you know how many tests are going to be performed in Bullhead City and what the turnaround time will be?
I don't know the number of tests, Supervisor Angus. They didn't really provide a lot of detail in their email. I was going to follow up, as I mentioned, and make sure that I could get some of that. So number of tests and turnaround time, correct?
Right.
Okay. And their turnaround time for their last testing event was about 2 days, 2 to 3 days. So, and that was with the testing occurring on a Saturday. So we'll just follow up and make sure that it's going to be consistent with that.
Okay. And they need appointments like last time?
Got it, yes. Yeah, and I'm pretty certain they're doing an advanced registration process, and largely because they don't want a long line of people waiting in cars during hot weather. And that way they have a really organized logistical approach to how they serve people as they come through.
Right, it worked well last time.
Mm-hmm. It did. It absolutely did. We'll continue to work with the schools in responding to questions. School board members have contacted us directly, and we're just going to start doing a frequently asked questions list. So as we get questions from school boards, we'll respond to them. And we'd like to send a lot of those responses out through the county superintendent of schools, Mike File, as he has those connections, and can do a blast email with all that information out to those school superintendents and school administrators, and then they can channel that information out to board members and also to their staff. And we'll continue to work through that. And
Denise, do we have any indication that there might be testing in the northern part of the county, either Kingman or Golden Valley?
I think we may be able to look at some of these other opportunities here, this Embry Women's Health potentially. The one thing that we do know is that, and I can also follow up and make sure that this is still the case, but is that there appears to be plenty of testing or testing availability up in the Colorado City area. So really our focus would need to be on some of the more rural communities, Littlefield, Beaver Dam, Scenic, and those areas, and see if there's an availability there or who we can partner up in that area of the county for that. Realizing that they have limited options, I assume, up in that area. We are trying to follow up with Canyonlands also to see if they have been providing any testing out of their clinic up there. And I just ran through all of my updates. It's a Monday,
Okay,
right?
does anybody have any comments or questions for Denise?
Madam Chair?
Supervisor Angus.
Hi, Denise. Can we just talk about the testing for a while, just to piggyback on what we spoke about on Thursday? Because there's a lot of bad information out there, a lot of bad test information. to the fact where people, including myself, don't really believe or trust a lot of it anymore. We talked about last week that the state counts differently than we do. And we talked about that as being a negative thing, at least for Mojave County. And they talked about that they're now counting COVID-like illnesses, which was a surprise to us. And we touched on it Thursday, but can you explain again what that means, what the COVID-like illness means, and why the state believes it's important enough to throw it in at this late stage after 4 months of counting a certain way, now that they're looking for ways to open up businesses, that they're throwing this in?
Certainly, Supervisor Angus, members of the board. Their primary interest in looking at COVID-like illness is how the illness impacts our hospital and our hospital capacity. And that is one measure of that, is how many people arrive at the ED and how many become inpatient as a result of COVID-like symptoms. And as such, once those people are admitted into the hospital, it's about, they'll certainly be testing those individuals if they do continue to exhibit those symptoms so that they can test and determine whether or not they have COVID.
But why now? Why didn't we get this information, back in April or May?
Right. I think I don't know that I can answer that question, honestly. I need to get back with the state to learn a little bit more about their surveillance system and the process. I know the system that they're using has been used for other communicable diseases, and our staff use that, have used it on a very limited capacity. But also looking at how they are applying it within the COVID world I can certainly go back and get some additional information and bring it back.
Okay. From your experience, from what you're learning now, how long does the virus stay in you? Because we've been hearing reports about people who test positive more than once. But from my research and what I'm hearing from professionals is that the truth is that it isn't recurring. It's just, it stays in your body because the PCR test is so sensitive.
Right.
Is that true?
That is correct, yes. So if you were...
And the reason that's
Go ahead.
Mm-hmm. No, I'm just saying the reason that is important is because there are still businesses and even local governments that are making people retest before coming back to work. And they're being shown as being positive, even though they're not contagious. They probably don't even have any symptoms, because according to all the information we've been given over the months, after 10 days or whatever it is, you're not contagious. If you're asymptomatic, and everything's just like what I heard when I was contact traced when I had it. So this is a lot of confusions going on in the community, and people have to stay home. Businesses don't have enough employees, and it's just kind of this vicious cycle. Is anything being done to address this?
Certainly with us, Supervisor Angus, we do not recommend getting retested, especially immediately following your isolation or quarantine period. Generally speaking, of course, our investigators and contact tracers or monitors are following up with those individuals to see how their symptoms are and make sure that they're improving, and we'll give them guidance if they're not improving. However,
right.
For those that have finished their isolation period or quarantine period and then moving forward, we don't recommend that, because your body probably does have some level of the virus still inside, and those PCR tests can pick that up and show a positive result as part of that. So
Is there any way we can get that information out in a press release, or if we are really not recommending something, but it's still being done in the community for all the right reasons? I'm not blaming anyone for doing it. They're still acting on that old information. So can we do that? Can we put out something from the health department about our recommendations?
Mm-hmm. Certainly, we can do that.
Okay. And the last thing I want to talk about is on Thursday we spoke about the gyms and the bars and restaurants, and I've been kind of busy with this. I spoke with the governor's office last week, and they reiterated what you told us about the different metrics, the substantial and the moderate and all of that goes into the decision making. However, in the course of my discussion, I pointed out that because we did not do the blitz testing like other counties did, I believe we are being punished, and that refreshing these numbers every 2 weeks is simply not fair. They actually agreed, and they're discussing refreshing every few days. If you go look at the state website and you go look at the other counties, even little Graham County, that has the fourth of the people we have, our population, they've done more testing than us. So percentage-wise, they're lower than we are, even though, if we had done the same amount of testing, we'd be lower. So, again, changing the goalposts, midstream. So they're discussing doing that a little differently. They've also lightened up on gyms a bit and told me that gyms can go ahead and submit their opening up protocols and attestation through that state website like we talked about. Mm-hmm. And even if they are in an area with substantial coverage like we were 2 weeks ago, but not now, they can get a settlement conference which may allow them to partially reopen. Senator Borelli is deeply involved in all of this at the state, and he's participating in 2 Senate roundtables, one for gyms, which will be tomorrow, and one for bars and restaurants on Wednesday. There will be industry representation from Mojave County, and I will be attending. We hope to get some sort of resolution this week, and that's all good news. Thank you.
Yes, thank you, Supervisor Angus.
Are there any other questions?
I have some questions, Madam Chair.
Supervisor Johnson.
Maybe, Ms. Burrow, you can clarify for me. You were talking with Supervisor Angus about the testing of people before they go back to work. And I think it's a little confusing. Are you trying to say that people cannot be reinfected?
No, Supervisor Johnson, they can be. But generally speaking, for someone to be retested immediately following their isolation period, if they've followed that and their symptoms have resolved and they're feeling better, then if they retest at that point, there's a strong chance that they would get a positive test as a result of that, even though the virus that's in their bodies is at such a low level that they're not going to be transmitting that to other people.
Okay, that's kind of what I thought, but it was coming off like people might not be getting reinfected. You and I have talked about this quite a bit. We still seem to see so many people under investigation. In the past 3 days, only a little less than 12% of the people had a conclusion. Do we need, and with the numbers dropping, do you have plans on maybe what you can do with all these people that don't seem to be able to do the contact tracing?
Supervisor Johnson, so to go back to the reporting piece of it, the part that is maybe missing information-wise in that is that when these contact tracers and these investigators follow up with cases, they're entering that information into a system that then gets uploaded into MedSys, and there's a delay in that reporting. And so it's not reported in the same way that we initially reported to the board when we were getting just a few cases coming in each day. So we are still collecting that information, but it's not necessarily available to report out to you in that immediate fashion as we have been able to do before. In regards to your question about the staff there, I think looking forward, we're looking at utilizing some of these staff for our school-based response. We recognize there are many, many, many schools and school districts throughout the county that are looking for some support and are going to need some technical support in addition to resources, and we'd like to have some of those staff participate in that effort. Right prior to, I mean, at this point we had 3 staff of our own health department staff responding, and each of those staff had a number of school districts, as you can imagine, to try to provide that assistance to and act as a resource to. So in this case, This would allow us to spread that out and potentially allow some of our staff to actually resume some of their normal work, if we could. So that way, those individuals can get back to providing, several of them work for tobacco prevention and prescription drug overdose, so we can get back to providing some of those services that we haven't been able to because we've been responding.
We're going to be seeing our snowbirds coming back pretty soon. And the question comes up, obviously they'll be counted wherever they're going to claim home is. If they're claiming that they live in Michigan and say we get a lot of snowbirds, that's going to affect our count. Have you taken that into consideration?
I'm sorry, Supervisor Johnson, could you repeat that question? I think I heard most of it, but I may have missed the first portion of it.
We'll be having snowbirds come flocking in here pretty soon.
Right.
And I'm guessing they're going to do, I mean, they could go either way, say, oh, yeah, my house is here or my house is in Michigan. Now, let's just say if we, perchance we get a lot of cases from snowbirds, but they're all reporting in Michigan and we don't get notified, especially with being a snowbird county and state, how are we going to handle that?
Well, I think what we've done in the past is, while that particular case would be reported to that particular county of residence, I do believe we get some information about those cases, and also that we have an opportunity really to follow up if we wish, because that, the distance between that person's home county and here is certainly problematic to ensure that appropriate follow-up.
Okay. In regards to businesses opening benchmarks in Mojave County, 2 weeks, say we meet the benchmarks and businesses are allowed to slowly reopen under the governor's guidance, what happens if Mojave County goes back in the red? Do those businesses have to shut down again?
That's a very good question. And actually, that's a follow-up question that I have with the state to determine whether or not that change in status changes how that business can operate in the county. So I appreciate you following up on that. And I'll try to have an answer for you at Thursday's meeting.
Okay, and I think, maybe I misunderstood you, but you were talking about hospital COVID-like and influenza-like illness surveillance. The state's been putting that on their website since day one.
Mm-hmm. You're saying they have had it on their website since day one, the CLI?
Yes.
Yeah.
Yes. Okay, because I thought we were saying we were going to look into that, but they've had it up there.
Yeah, I do believe they do have a link. What I haven't checked out is to see, I'm assuming that's also broken down by county level data, but I do need to take a look and see if it's county level or if it stops at a state level.
Those are the only questions I have, Madam Chair. Director, thank you.
Okay,
Madam Chairman.
Supervisor Gold.
Thank you, Madam Chairman. Denise, did we ever get a definition of COVID-like illness?
I would need to look up the official piece and get some information from ADHS to make sure that I give that to you accurately.
My concern is that if I had a chest cold, I would have a COVID-like illness.
Yes, that I definitely understand, especially as we move into flu season. We recognize that there is, as you know, some overlap in those particular symptoms. And I just got a note.
If you could find that out.
Certainly. I will follow up with that for sure. So the CLI data that ADHS posts on their website is by region, so that includes Mojave, La Paz County, and Yuma counties. So it's not specific to our county. So just as far as the information, how it's reflected on the ADHS dashboard. Just wanted to, but I'll follow up on some of those other questions around COVID-like illness. Any other questions?
Madam Chair,
Supervisor Angus?
I just have one small clarification because it seemed to contradict what we said when Supervisor Johnson asked the question about reinfection. So when we say reinfection, you're talking about a brand new case with new symptoms, newly contagious again. Have we seen any of that here?
We have, actually. And at the press conference, I don't know if it was stated during the press conference or immediately following, the CEO of Havasu Regional Medical Center did share that he had seen a re-exposure, reinfection for an individual. I don't know the frequency of that at this point, Supervisor Angus, and what % of cases end up as a reinfection, but I'm sure we'll know as we move forward that that's a possibility.
I'd like clarification on that because I think that's important for people to know. I mean, everyone is nervous enough. A lot of people who have it think, okay, well, I've got the immunity and I'm good to go and I'm free to move about the country. And then all of a sudden, again, this just keeping us in a constant state of fear. So I'm trying to alleviate some of that. So if we can really get what that information is, because that is the only case I've heard from anywhere. So I really would appreciate if we can get the the 411 on that. Okay.
Yes, absolutely. We'll do some homework on that for you.
Okay. Thank you.
Okay, I believe that concludes our questions. And Denise, I'm looking forward to seeing the new fact sheet and the way that we're going to be reporting this going forward.
Thank you.
Okay, moving on to item number 2. This will be a discussion on possible... Supervisor Angus, did you say something?
Has left the conference.
Oh, okay. Okay, discussion of possible action. Ray approved Mojave County's 2021 CSA legislative program proposals and allow for additional proposals to be brought forward as needed. So I know we have one proposal already submitted to provide financial assistance for mandated legal defense. So that's one we're bringing back from last year and the year before. So I believe we need a...
Madam Chair.
Yes.
On that particular one, just to inform the board that indeed this has been considered in the past and got unanimous support at CSA but did not go any further. This year we took a little different approach, but the same concept. We reached out to Yavapai County, and Yavapai County's Board of Supervisors has also approved a similar language. Much of it came from ours last year, and we'll be supporting it. We reached out to Yuma County, and Yuma County will informed us that they would support it. They are not submitting one themselves, but they will support it as well. We're just hoping by joint sponsorship that this will get across the finish line. What we heard from our colleagues is that we need some legislative support to get it across the finish line. That's really in the past where we have fallen short. That's where it occurred. So to that end, we're hoping we will have more success this year than in years before, simply because the cost to the counties, and it varies between one county and the next, but to Mojave County, it truly has been significant, and getting some relief would be really helpful. So if you, the board members, have an opportunity to interact with the legislatures that represent the area, please feel free to communicate your thoughts and needs and concerns. Thank you.
Okay. Does anyone have any questions, additions? Supervisor Watson.
Thank you, Chairman Bishop. Along with the proposal for the juvenile delinquency filings and case costs, I'd like to add 2 items that are concerning water. Both those items I can clearly define at our next meeting. I'm awaiting a conversation between our lobbyist, Patrick Cunningham, and our representative, Regina Cobb, for further clarification on those 2 items. But I would like to make room for those 2 items in our room for our summit information.
That's good news. Thank you. Any other comments, additions?
Has joined the conference.
Okay, I'll entertain a motion.
I'll make a motion to send the CSA legislative program proposals as identified earlier, and the juvenile delinquency issue, and the 2 water issues to be further defined at our next meeting.
Okay. We have a motion on the floor. Is there a second? I'll second it. All those in favor, say aye.
Aye.
Any opposed?
Aye.
No.
Madam Clerk, did you get the, okay, and it passed, right? Okay. All right, going on to item number 3. This will be a discussion on possible action, re-adopt the 2020-2021 tax levies and rates for Mojave County tax authorities, and acknowledge the tax levies for special districts, school districts, fire districts, and cities and towns in accordance with ARS 42-17151 and 42-17254. Okay, is there any discussion, or is there a motion?
Madam Chair,
Supervisor Angus.
this goes our yearly debate about our taxing districts. I don't believe that we should be voting on this. I know it's just to accept it. I think it's just an administrative function, so I'll be abstaining on this.
Okay. Is there a motion on the floor?
We should be voting on this. I know it's just to accept it. I think it's just an administrative function, so I'll be abstaining on this.
Supervisor Angus, I understood your comment. I'm looking for a motion.
I didn't say anything. It just repeated what I said.
Yes. I understood. You said it and you repeated it. Got it.
No, I didn't. It's just repeating on its own.
Supervisor Angus, I am not understanding you very well.
I'm going to hang up since I'm abstaining anyway because there's some technical difficulty because it keeps repeating what I'm saying. So, bye-bye.
Okay, Supervisor Watson.
Thank you, Chairman Bishop. Could we have our legal team explain the necessity of adopting the tax rates?
Sure. So thank you, Supervisor Watson. By statute, the process is that each of the governing boards put together, they set the tax rate. They adopt a budget and they set tax rates. Mojave County has done that. The taxing districts for the school districts, for the fire districts, the special districts, they've all set those. Once those are set by statute, they come before the board and they have to be adopted by the Board of Supervisors. I believe it's the 3rd Monday of the month. I believe so we have to do it today, basically. And by statute, the Board of Supervisors is responsible to set those tax rates. It is the Attorney General's office and the Arizona Supreme Court has deemed this to be a ministerial function of the board, but it is required. It is something that you must do. There will be significant consequences if you choose not to do that at this time. The consequences could be, 1, the districts will have confusion. They won't know what their tax rates are supposed to be because the board did not fulfill its responsibility. 2, the Treasurer's Department will not know what to do because they don't know what the tax rates will be and how those taxes should be collected. And 3, if the board chooses not to fulfill its responsibility a taxpayer could file a suit against Mojave County. There would be a mandamus action. The mandamus action would be arguing that the board has failed to fulfill its responsibility. If the court finds that if the court finds that the board has failed to fulfill its responsibility, then the board will be responsible for the payment of those attorney's fees as well. So it is required by statute. It is set by statute. We have had this debate yearly, as Supervisor Angus has pointed out, and I totally see Supervisor Angus's position on this, but I also disagree. It is the board's responsibility, and it is set by statute. And until that statute changes, our recommendation is that you adopt the tax levies and rates for Mojave County, acknowledge the tax levies for the special districts, school districts, fire districts, and cities and towns.
Thank you, Mr. Esplin. And I'd like to reiterate the possibility of our liability if not adopted.
That's correct.
Correct?
Yes.
So with that, I'll make a motion that we adopt the 2020-2021 tax levies and rates for Mojave County tax authorities and acknowledge the tax levies for the special districts, school districts, fire districts, and cities and towns in accordance with the Arizona Revised Statutes 42-17151 and 42-17254.
Okay, we have a motion on the floor. Is there a second? I'll second the motion. Madam Clerk, let's do a roll call on this.
Supervisor Watson?
Yes.
Supervisor Johnson? Oh, he got disconnected. We
Has
may
left
want
the
to-
conference.
Supervisor Johnson?
Supervisor Johnson?
Has left the conference.
Yeah, we're having some technical trouble there.
Okay, can you see if Supervisor Gold is
Supervisor Gould, are you there?
I am here.
And do you vote yes or no?
If the taxing authorities would adopt a rate that held for no tax increase, I would be more than happy to vote yes, but since they won't, I'm going to vote no.
Okay, thank you. Chairman Bishop?
Yes.
And let me see if we can get Supervisor Johnson back on the line, because Supervisor Angus is abstaining, is that correct? At this time, I have 2 yeses and a no. However, I believe, I'm not sure if Supervisor Johnson is able to get back on, and I know Supervisor Angus is abstaining.
So, and if I may,
Yes,
Chairman.
Supervisor Watson. We could always move this to the end of the agenda and see if we can get Supervisor Johnson on the phone.
I believe we still have a quorum. with
Yes, we
3.
do. We do have 3. We have 2 yeses and
2
1 no.
yeses. So the motion, I believe, would prevail. Is that correct?
Supervisor Johnson?
Has joined the conference.
Oh, there we go.
Supervisor Johnson?
Sorry, I got cut off and couldn't get back in for some reason.
We're doing a roll call vote for the, for item number 3 for the tax levies.
Okay, I kind of lost it when Supervisor Watson was talking. Maybe you can maybe the attorney would clarify for me, but because we did this once before, we turned down a school district, but if we turn down their tax levy rates, we can become responsible for the districts, isn't it?
Yes, and so Supervisor Johnson, I am concerned if you do not pass it, if the tax rates are not set. I was explaining the concerns that I have. There'd be confusion. The Treasurer's Office would not know what to do, and there's the potential for liability, as you pointed out, for not fulfilling the responsibility of the supervisor. So yes, there is a liability concern.
Thank you. I'm a yes vote, Madam Chair, Madam Clerk.
Okay, thank you very much.
So we have, motion carries 3-1 with Supervisor Angus abstaining.
Okay, thank you. Going on to our final item, number 4, setting as the Board of the Mojave County Free Library District. This will be a discussion of possible action to approve utilizing State of Arizona cooperative contract for furniture, products, and services with Education Furnishings of Arizona, LLC, to purchase a furniture package including lockers, shelving, tables, seating, and the installation services necessary for the completion of the Kingman Library remodeling project on behalf of Mojave County's Free Library District at a cost of $54,819.54. Source to FY21 budgeted fund 818781000-48530.
Motion to approve.
And I'll second the motion.
We have a motion on the floor, seconded by Supervisor Watson. All those in favor say aye.
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 Any opposed? Okay, motion passes. And this meeting is adjourned.